Hey everybody, it's Gabe and Alan from Integrity with a little bit of an update. We're getting a lot of calls with regards to open enrollment again, except for this time it's with regards to Medicare.
Right.
And so Alan's with me, he specializes in Medicare, and we want to share a couple updates with you. And so one of the questions I had is, what does open enrollment for Medicare mean? What the heck is going on? What should I be looking for? And those people want to know. So I'm going to ask you, Alan, what's open enrollment?
Yeah, so open enrollment, guys, and the simple answer is that it's a time for us to review our current Medicare plans, make sure it's still doing what it's supposed to do, and if there's some changes with our plan that we have currently, we're able to make a change and maneuver into a different plan or a different choice. So we want to review those things closely and make sure that we're not losing anything or missing out on something.
Right, because we hear a lot of things that there's changes being made right now with the Medicare plans and health insurance in general.
Yeah.
But when we talk about open enrollment, what are the dates? Like, what are some deadlines or things that I need to be aware of as a consumer looking for Medicare coverage?
Yeah, so good question, Gabe. So I would say it's very simple. So right now, it is the time. So October 15th, and our deadline to get all this done is December the 7th. So from October 15th, so from today till December 7th, we have a chance to review our plan, and if we do want to make a change, we can go ahead and make those changes. So that would be, our opportunity and our time window. Excellent.
Now, there's so many options out there, what is it, if I'm already 65 on a Medicare plan, what are some things that I should be looking for? And then for those of us who are just turning 65 or know someone who is, what are some things that they should be looking for?
Okay. So I think it's important, and especially during open enrollment, you want to make sure that your plan, like I mentioned before, is still doing what it's supposed to do. So some of the key things that we look at when we review a plan, the biggest one is for those that are on medications. Okay, medications, as you guys know, you hear about this all the time, they'll break you, right? So there's something called the infamous or the not famous donut hole, right? We don't want to get into that, but the whole idea is we want to review those medications and the cost associated with them, because one plan might have better benefits for my prescriptions than another plan does, right? Mm-hmm. Another thing we want to look at is our maximum out of pocket. How much am I on the line or on the hook for if something, God forbid, did happen to me emergency-wise? We want to make sure that we have the lowest max out of pocket as possible. So those are some of the things that we look at right away. And of course, has a doctor moved out of network, or can I still go see the specialist? Mm-hmm. Things like that. And there's a lot of other new things that plans come out with, and if you don't know about them, you might miss out.
Right. And the common question that we get in our offices is we hear the word supplemental and we hear the word advantage plans, and there's some confusion as to what are our options. And so can you talk a little bit about that?
Sure. So some of you have what's called a Medicare supplement, and some of you have what's called a Medicare Advantage. Okay, so the big thing is that you, no matter which one you have great coverage. Okay, so I would say the biggest thing with Medicare supplements. Okay, so these are also known as Plan Fs, Plan Gs, Hs, A, B, C, D, E, F, G. 1, 2, 3. It doesn't matter which one you have. Those are what is known as kind of like a PPO plan. And the advantage is that with one of those plans, you can go to any doctor, any hospital at any time. Okay.
Nice.
So no limits on where you can go. The disadvantage of those plans is, for that advantage, you're going to actually pay a monthly premium for that plan. Okay. In some cases, they're between $180 to $200 a month. And then in addition to that, you also have to have a prescription drug plan, which also has a monthly premium, okay? So that's the advantage, disadvantage, Medicare supplement. The Medicare Advantage plans, these are probably the most popular, and the reason why is the big advantage is there is no premium. You get all the coverage that a Medicare supplement provides with no monthly premium, okay? So many are attracted to that, and I for one, like those plans quite well. The disadvantage, however, would be is I got a limit on who I can go see. It's an HMO network. So what does that mean? Well, it means if I have 7 different specialists I go see, well, there's a chance that I might not get to see 2 out of the 7, you know, because they're out of network and they don't take HMO plans, which is I've seen happen. And in some cases, it's worth, you know, going on to a Medicare supplement and paying the extra premium so that you can still go see these people. And then sometimes it's not. So those are the things to consider: Medicare supplement versus Medicare Advantage. But talk to us about it and we can help you make that decision.
Perfect. So let's say that, you know, we haven't had a chance to sit down, they haven't had a chance to sit down with us to evaluate their options. Let's say I start down the path of supplemental plan and I want to make a change to a Advantage plan. Am I able to do that?
Yeah. So good question. So the big thing, guys, is when it comes to the plan you're on, and this is the whole purpose of open enrollment, is that you get to make a change. So if you have a Medicare Advantage plan now and you're like thinking, hey, I think I want to go to a Medicare supplement, well, you can, okay? Now I will say this, you do have to qualify for a Medicare supplement. So they do base this on, you know, age and health, so premiums do go higher. You do not, however, if it's your initial enrollment stage when you're just turning 65, it's automatic. But if you've been on Medicare for a while and you want to move to a Medicare supplement, you will have to qualify. So open enrollment, you can move from a Medicare Advantage to a supplement, or a Medicare supplement to a Medicare Advantage.
So that's another reason to contact us, so we can go through those benefits and disadvantages and how they apply to you. The other thing that, you know, right now mailboxes are full. There's a ton of mail coming in with so many options, and you know, I like things that are free. And a lot of these plans are saying, hey, you get some freebies if you come with us. Yeah. So what are some things we should be aware of?
Okay, so that's a good question too, because I think most of you guys, I've already seen them. The commercials are on TV all day, all night. For those of you guys that seen them, you know, so you got a lot of carriers that are out there putting up their ads for open enrollment, and they're talking about some of the cool things that they're giving away. Some of the things that we see commonly is, you know, what's called the gym membership. So you get to go to the gym, there's no cost. It's called Silver Sneakers. There's a couple other versions of that, depends on which plan you're on, but they have free gym memberships. A lot of vision benefits, dental benefits that are included on some plans are not. Some of the big things this year, I was reading some of the plans, is one of the carriers is actually giving away like a free Fitbit. Okay.
Whoa.
So, and it's not the cheap one, it's actually the level 2, where it has the heart rate monitor, and you know, it's kind of like an Apple Watch. Wow. in a sense. But there's things like that, and you're not going to know about these things unless you dig into your plan. Hey, what does my plan offer? What can I get, right? What's in it for me, right? So, yeah.
Right. So it sounds like there's a tremendous amount of options, details that we need to be made aware of. So, I mean, we would encourage our clients and those of you who are watching this video to contact our office, sit down with us to evaluate what plan is best for you. So contact our office today. Again, Ellen and I, we thank you for your business, and we look forward to talking to you soon.
Thank you, guys. Have a good one.